Can you hear me? S.O.S. Help me put my mind to rest. 2 times click and I'm acting low.
Hey guys, welcome back to my channel. So in today's video, I wanted to dive into a more personal topic, and what that topic is endometriosis and ovarian cysts. And the reason that I'm making this video is because I recently found out that I had both ovarian cysts and endometriosis, and I had no idea what that meant. I kind of had a little bit of an idea because my sister was just diagnosed late last year with endometriosis, and I wanted to make this video for women out there that are suffering with either of these things and they don't really know what it is or what to expect or what surgery to do, all of those things. So I wanted to address those things in this video, as well as give you my personal story and experience. So I hope this video helps you. Please share it with anyone that is suffering with endometriosis or ovarian cysts, and if you are interested, then please keep watching. Alright, so before I dive into my story, I did want to read you a brief definition of endometriosis in case you don't know what it is or you need a refresher on what it is. So this is from the Mayo Clinic website, and what it says is endometriosis is an often painful disorder in which tissue that normally lines the inside of your uterus, the endometrium, grows outside of your uterus. Endometriosis most commonly involves your ovaries, fallopian tubes, and the tissue lining your pelvis. Rarely, endometrial tissue may spread beyond your pelvic organs. And when they say spread beyond your pelvic organs, it can spread to your heart. They found it on someone's brain before. So it's definitely best to catch this as soon as you have it. The problem is that a lot of women have no idea that they have it, myself included. I had zero idea that I had endometriosis, but it is estimated that 1 in 10 women have it. However, I find that kind of funny because a lot of women don't know that they have it, so I don't know exactly how they get that statistic, but that's what they estimate. 1 in 10 women have endometriosis. And there are a couple of theories as to why women get it. One being that you are born with it, and then once you start having periods that it's activated, and from that point on you have endometriosis. And then the second theory is that it's due to retrograde bleeding, which retrograde bleeding is when, like, versus your blood shedding, all of your blood shedding every single month, that blood goes back up through your fallopian tubes and into your pelvic cavity. So basically you're having internal bleeding, which is causing a lot of the pain that you experience when you have endometriosis. And those are just theories, but some people argue that every single woman has retrograde bleeding. It's not just people with endometriosis. So those are the 2 main theories that I have found, but it is interesting to read what they think causes it. But of course, they don't know for sure what does cause endometriosis, which is very frustrating. And before I dive into my story, I did want to briefly tell you about my sister. And she is 31 years old, and late last year she was cleaning and she just dropped to the floor in excruciating pain. She had no idea what was wrong. She was crawling. She couldn't even stand up. It hurt to stand up, sit up straight, all of those things. And of course she was really scared and had zero idea what was happening. And keep in mind that she had pretty painful periods. She had always had that, and like between her and I really never experienced anything like that. I just thought it was fairly normal, but I mean, what is a normal period? I don't really know the definition of that either. I think it varies for every single woman. But so she had had painful periods, and she went to the doctor, and come to find out her cysts were covered in her ovaries were covered in cysts, and she also had uterine fibroids. She had I cannot remember how to pronounce this, adenomyosis, which is when that endometrium, that layer that grows outside of your uterus with endometriosis, also grows into the lining of your uterus. So rather than just being only on the outside, it grows into that lining of the uterus also. And she had stage 4 endometriosis, which there are 4 stages of endometriosis. So she had the top one, the worst one. And so she discovered that. One doctor told her that she should have a total hysterectomy, that there's no point in just going in and cutting out the cyst. But she did opt for the excision surgery versus the total hysterectomy. And when she did get that surgery, the doctor nicked her bowel, and so she almost died several times. And they gave her an ostomy, which if you don't know what that is, look it up. She had that, and then in April that was reversed. So they put, so with an ostomy you have your intestines are basically pulled out through your abdomen, and so that was reversed. And she is doing a lot better. She's almost healed, definitely not completely healed, but almost healed from that emergency ostomy and excision surgery. And so forward to me, and this is in late July of this year. I am just standing there, and all of a sudden I collapse, just like she did, in excruciating pain, sharp stabbing pain. Couldn't sit up, couldn't walk. I mean, I could walk, but it hurt really, really bad. And on a pain level from 1 to 10, I would give it an 11 out of 10. It was so painful. I can't even describe to you the pain that it is, but I had zero idea what was going on. I did think back to her, and I was like, this is kind of odd, and I had never had painful periods or anything like that. And so I was researching the heck out of everything, like what in the world could this be? And so if you go onto the internet and you research your symptoms, you sign your death warrant, because everything that you look at is just so morbid and terrifying. But I deduced that I might have appendicitis or a burst appendix. And so I did go to the doctor about 3 days after I had collapsed on the floor, which I probably should have gone sooner. But 3 days after that, I did go to the doctor, and he almost immediately ruled out appendicitis because I did not have a high fever and I was not throwing up a lot. So those are 2 like classic signs of appendicitis, and also a sharp pain in your lower right abdomen, which I did have that, but the pain for me started in the center, like where my navel is, a sharp shooting pain. It moved to my upper abdomen, and then finally it ended like in my right lower abdomen and would move to my left and right back and forth randomly, and it really hurt to lay on my right side. I do remember that. And so he almost immediately ruled out appendicitis. So I got a CT scan, and they found out that I had a very large mass in my pelvic cavity right behind my uterus. And so from that, they really couldn't tell too awfully much, so he ordered a transvaginal ultrasound. And when you go to the doctor and they're trying to rule out things and determine what's causing the pain, they want to assume that you have like STDs and that you have these horrible sexually transmitted things. But like I was assuring them, no, I do not have those. I know for sure I don't have those. But of course they want to be certain that you don't have anything like that. And he also wanted to rule out pelvic inflammatory disease, which I kind of thought I probably didn't have that, which I didn't, but he wanted to rule that out. And so on the transvaginal ultrasound, that gives them a much clearer look into your pelvic cavity. And so, but even still from that, they couldn't really tell too much. They just said that it was about 11 centimeter or 12 centimeter cyst. One person said one thing and someone said something else, but a very large mass. But she couldn't tell whether it was attached to my right ovary or my left ovary. And so then from there, I went to the OBGYN. And also before I did go to the OBGYN, they had me do a lot of blood tests. So they did do the CA-125 blood test on me, which that is testing for ovarian cancer. But the problem with the CA-125 is that it doesn't automatically, like if your level is high, it does not mean that you have ovarian cancer, because a lot of other things can elevate that level, ovarian cysts being one, endometriosis being another thing. And polycystic ovary syndrome can elevate that. So there's so many different things can elevate that CA-125. So my CA-125 was 125. So, and the doctor had called me back and said that it was slightly elevated, but he wouldn't really worry about it. So of course I am worrying about it because it's scary to think about. And there's not a cure for ovarian cancer. So of course I was scared about that. So I go to the OBGYN, and almost immediately, like 2 seconds into his examination, he can feel the cyst. So he said it's definitely large. We definitely need to get it removed because it can burst. It can cause like ovarian torsion, which is cutting off the flow to your ovaries, the circulation to your ovaries. So he scheduled that surgery for the end of August, and he had asked me like if I ever had any, like what symptoms I had, and I said not really anything. Like I didn't really have painful periods, but the funny thing with that is that I think that's so subjective. It's because someone's pain tolerance can be a lot higher or lower than somebody else's. So I said no, I think it's pretty normal, and the only symptom that I had was this, all of a sudden, this shooting pain in my abdomen that lasted for several days. But then I got to thinking about that, and I actually did have a couple of other symptoms. One being that in the middle of the night, I would get up and have to go to the restroom. And for me, that was highly unusual because I never did that. And that's been going on for several months now. I know at least 3 months I've been doing that. And the other thing was that I was bloated feeling, and in and around the time of my period, I will be bloated, but maybe for like a day, 2 at the most. So for me, that was also highly unusual, and I could see it, like versus 1 or 2 days, it would be like I would feel bloated constantly, like just days on end, and I could see it in my stomach, and I just found that really odd. I said something is not correct with that, but I never, until after my surgery is when I had this thought, and I put 2 and 2 together that was obviously causing that bloating. And for me, I'm 5'4". I generally stick around about 120 pounds, give or take 1 or 2 pounds. And so I was weighing about 127, 128, and I just thought that was odd because I wasn't really doing anything to make me weigh more than about 120 pounds like I normally am. And so that was also odd for me. It was odd. And so I did get the surgery done. It was about a week and 1 day ago today that I got it done. So late August, and they did a laparoscopic surgery on me, which is where they make 3 or 4 small incisions on your abdomen. And I will insert a clip or video here so you can see what I'm talking about. And one of those incisions is through your belly button, and that is the largest incision, and that is where they will take the cyst from inside your abdomen outside so they can take it out. And before they do that, they have to drain it before they can take it out through your abdomen. So they have a camera in one so they can see what they're doing. They have little, I don't know the technical term, but little like snippers or scissors to cut the cyst out of your abdomen, and then something to obviously drain it and take it out through your abdomen. So they are still healing. They are still a little sore and red, and they did prescribe oxycodone for me, but I only took 3 of those, I believe, 3 or 4 of those pills. And they also gave me an 800 milligram ibuprofen. They said I could take that up to 3 times a day. And then they also gave me an antibiotic, ciprofloxacin. And then they also gave me I can't remember how to pronounce this one, ondansetron, something along those lines, which is for like nausea, like associated with taking an antibiotic. But I didn't even take one of the nausea pills, so I was pretty happy about that. I didn't feel nauseous at all. The main symptom that I've been having is a kind of a persistent headache, and it's all like right here, so like in the front of my forehead, and sometimes I'll get like a little shooting pain up at the top of my head. I'm not sure what that's about, but I was reading about it, and it is common to have a headache after surgery, and that's normally due to the anesthesia that they give you. So I don't remember one single thing from the surgery. You go in before your surgery, you do a pre-op appointment, which is where they take blood work and just get you prepped and ready to go for that surgery. So mine was 2 days before I had my actual surgery. And so I did that, and then they want to make sure that the vitamins or supplements or anything that you're taking won't interfere with the surgery. So if it is, then they tell you not to take that like 24 hours before you go in for surgery. So I was taking evening primrose oil and vitamin D, and they told me do not take those. And also I was taking ibuprofen, like about 2 a day for the pain that I was having before surgery, and they said do not take those either. So just a heads up, if you are taking those things and you are getting laparoscopic surgery, they will tell you not to be taking those before you go in for your surgery. And the day of surgery, you go in and they have a long list of things that you cannot do. So you can't have any makeup, you cannot have fingernail polish, you can't have any lotions, creams, deodorants, like, you know, highly scented things on your body to interfere with that surgery, and, you know, bacteria and getting into little cuts and things like that. And I believe that's all they told me for that. And so you go in the day of surgery and they get you prepped and ready to go. They insert the IV so that the anesthesia can go into your IV, and they give you something to relax you first. So they did give that to me. They roll you down the hall into the surgery room, and then they put an oxygen mask over my face, and immediately, like right like that, I don't remember anything. And then I was up and awake, and I did have a lot of discomfort right when I woke up, and they did give me fentanyl through my IV. That did not do a thing for me, so they ended up giving me 4 I guess you'd call it 4 doses of fentanyl, and she said that's all that they could give me. And she said it should have knocked you out by now. It did not knock me out. I was still wide awake, and that did not help. For me, that did not help my pain whatsoever. And once I was awake, they did wheel me into an actual room. And so normally laparoscopic surgery is just an outpatient procedure. So you go in the day of, you leave the day of. But for me, they did want to keep me overnight. I think just to monitor my pain. So they did monitor that, and basically I was okay and fine. And of course they obviously want to make sure that you use the restroom before you leave, just to make sure that everything's working as it should. And so from that surgery, the doctor told me that I had not 1 but 2 10-centimeter cysts on my ovaries, so about the size of an orange. So 2 of those. I did indeed have endometriosis, and it was on my bladder, my bowel, and my ovary, so basically all around my pelvic cavity. And also, the third thing that he told me was that my fallopian tubes and my ovaries were tied behind my uterus. And the only reason I can think of for that is that in endometriosis, you often have these like spiderweb like strands from the endometriosis. And I think those strands were drawing back the fallopian tubes and ovaries behind my uterus. So he did free up the fallopian tubes, and he could not free up the ovaries, because in order to do that, he would have had to cut my abdomen completely open in order to get those out. So that is all that I found out from my surgery. I have my checkup next week, and I do want to ask him, because he told me that whenever I do decide to have children, that my ovaries being behind my uterus would not cause any problems, or that I should be able to have children. My question for him is going to be, would that cause any complications, those ovaries being behind there? Because in my mind, it seemed like it would cause some kind of problem, but I don't know the answer to that yet, and I haven't researched that yet, but I do want to ask him that next week when I have my checkup surgery. And also, I did want to mention that I haven't seen him yet, like I said, for my follow-up appointment, but he did mention 2 options for me for managing endometriosis, one of those being like a low-dose hormone birth control pill, and the other being a medication called gonadotropin, which just briefly reading about that, it's pretty scary to me. If any of you watching this video are taking that, I would love to know if you are, and if you are taking it, what you think about it, how it makes you feel, anything like that. I would love to hear what you have to say about that, or even taking birth control pills for endometriosis. I would love to hear what you have to say about that, so please leave your comments down below. And so for the gonadotropin, it says it's a releasing hormone agonist therapy, which is widely used to shrink endometriosis implants, which should relieve pain. GnRH therapy is usually a second choice treatment that is used when several months of birth control pill therapy have not been effective. So like I said, I'm not on anything yet because I haven't had that checkup appointment, but I know that when I go, this is going to be something that we will be discussing. So I did want to mention that those are two options for endometriosis, but I can't say anything about them yet because I am not on either one. But basically what I learned from my experience is that it's best if you experience anything that to yourself, not compared to anyone else, but to yourself, if it's odd to you and it feels, if something's not right to you, to go get it checked out. Because more often than not, when you go in, as soon as you have that odd sensation or that pain, that you will be much better off for it. So I wish I would have gone in months earlier when I had these random things happening to me that I really thought nothing of. I wish I would have been more attuned to it and thought to have gone to the doctor sooner. So that is what my takeaway from the whole experience is always it's better to be safe than sorry. Always to listen to your intuition, to yourself, and not judge it off of someone else's experience, just purely on your own self, and go into the doctor and get checked out. So there are several websites for finding out about endometriosis. There's also a support group for endometriosis, and I will link some of my favorite websites down below so you can check them out. And I hope this video was helpful, whether it's for you or for someone that you know suffering with endometriosis or ovarian cysts. I hope that this helps them or yourself, and thank you so much for watching, and I will see you next week.
I can feel your touch picking me up from the underground. I don't need we could be more than just part-time lovers.